Studies have shown that what we need to do in CPR in terms of uninterrupted high-quality compressions is very difficult to do just with our hands. And one of the things that's come out in recent years is that pausing is very detrimental to the patient.
Manual compressions are very difficult to do consistently and well. Even when done properly, they only provide 30 to 40% of normal blood flow to the brain and only 10 to 20% of normal blood flow to the heart.
The AutoPulse is a unique device in that it uses the way that it squeezes the chest. It takes advantage of the cardiac pump mechanism where you're squeezing the heart directly between the sternum and the spine, and the thoracic pump mechanism where you're increasing and decreasing intrathoracic pressure to move blood. The AutoPulse is battery operated. It has a life band that goes around the patient's chest, and to use it, we put the patient on the platform, close the band, press the button. It's going to measure the chest, and then it's going to compress the chest. And right now it's operating at 30 to 2, so it'll give a ventilation pause after 30 compressions to give your two breaths. You can move it into continuous mode for uninterrupted compressions. And what it's doing is this band is, again, it's measuring the chest and it's squeezing the chest and displacing at 20%, which is equivalent to 1.5 to 2 inches for American Heart Association guidelines. It's measuring what it's doing all the time. It actually has a load sensor here that monitors the amount of force that's being applied. And then, of course, it's measuring the chest at all times, so it knows how often it's pushing, how much force it's applying. And because it applies the force over such a wide area, it only exerts a fraction of the pressure on the chest that you would with your hands. When you're doing manual CPR, or say with a mechanical device with a small surface, you're applying all the pressure in a relatively small area. The AutoPulse applies it over such a wide area that it only is actually giving a fraction of the PSI, if you will, on the patient's chest. You can do it continuous compressions on the patient, even during transport to the hospital or while carrying them up and down stairs and so forth.